Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Edarbi. Edarbi tablets contain the active ingredient Azilsartan medoxamyl, which is a type of a medicine called an angiotensin II receptor antagonist. So what is it used for? It's used for high blood pressure with no known cause. That's also caused essential hypertension in adult patients over 18 years of age. A reduction in blood pressure will be measurable within 2 weeks of initiation of treatment, and the full effect of your dose will be observed by 4 weeks. So lowering high blood pressure helps prevent strokes, heart attacks and kidney problems. This medicine can only be obtained with a prescription from your GP or your doctor. So how does Edarbi work? Azilsartan works by blocking receptors in the body known as angiotensin II receptors. This prevents the action of a hormone called angiotensin II. Angiotensin II is involved in regulating blood pressure and fluid balance, and it has two main actions. It causes the blood vessels to narrow and the kidneys to retain salt and water. Azilsartan blocks the receptors that angiotensin acts on, and so prevents its action. The main result of this is the peripheral blood vessels are allowed to widen, which means there's more space and less resistance in these blood vessels. So this is the main mechanism by which the pressure in the blood vessels is lowered. So blocking the action of angiotensin II also increases the amount of fluid removed from the blood by the kidneys. This decreases the amount of fluid in the blood vessels, which also lessens the resistance and pressure in the blood vessels. The combined effect of these changes is to lower the blood pressure. Hence, Azilsartan is used to treat high blood pressure. So how do you take it? Edarbi tablets are taken orally by mouth once a day, preferably at the same time each day. The dose of Edarbi prescribed will depend on how well your blood pressure is controlled. So you follow the instructions given to you by your doctor and pharmacist. These will be printed on the dispensing label on the packet of medicine. Edarbi tablets should be swallowed with a drink of water, and Edarbi tablets can be taken either with or without food, whichever is more convenient. Edarbi should not be used in pregnancy, particularly in the second and third trimester, as it may be harmful or cause death to the unborn baby. So stop using this medicine and tell your doctor right away if you become pregnant. Regarding breastfeeding, it is not known if this medicine passes into breast milk, and it is not recommended for mothers who are breastfeeding. So people with severely decreased liver function, and also children and adolescents under 18 years of age. So it's not for those two groups either. What should you avoid while taking Edarbi? So first of all, do not use potassium supplements or salt substitutes while you're taking Edarbi, unless your doctor has told you to do so. Avoid getting up too fast from a sitting or lying position, or you may feel dizzy. Get up slowly and steady yourself to prevent a fall. So the side effects of Edarbi are generally mild or moderate, with the most common side effects being dizziness, diarrhea, increased blood creatinine phosphokinase, which is an indicator of muscle damage. You stop taking Edarbi and seek medical help immediately if you have any of the following allergic reactions: difficulty breathing or swallowing, a swelling of the face, lips, tongue or throat, and itching of the skin with raised lumps. So how can this medicine affect other medicines you might be taking? If Azilsartan is used in combination with other medicines that lower blood pressure, either to treat high blood pressure, such as antihypertensives, or as a side effect, the combination might lower your blood pressure too much. So this would make you feel dizzy or faint, particularly when moving from a lying or sitting position to standing. If this happens to you, you should sit or lie down until the symptoms pass. This is more likely to happen when you first start taking Azilsartan with one of these medicines, particularly if you've been taking a high dose of a diuretic. So tell your doctor if any dizziness persists, as your medicine doses may need adjusting. Also, Azilsartan may increase the blood level of a medicine called lithium, and the combination is not recommended. If it is necessary to take both lithium and Azilsartan, your doctor should carefully monitor your blood level of lithium. You should let your doctor know if you experience any signs that your lithium level is getting too high. For example, loss of appetite, diarrhea, vomiting, blurred vision, muscle weakness and drowsiness, tremor, unsteadiness, a ringing in the ear or confusion. So next, Azilsartan may increase the level of potassium in your blood. So if this medicine is taken with other medicines that can increase blood potassium levels, the effect may be enhanced. These are not usually recommended for use in combination with Azilsartan. So if they are used in combination, the amount of potassium in your blood should be monitored by your GP. Next, the following medicines may reduce the blood pressure lowering effect of this medicine. So corticosteroids such as dexamethasone or prednisolone, estrogens such as those in the contraceptive pill, and regular use of non-steroidal anti-inflammatory drugs such as ibuprofen, diclofenac or indomethacin, which is an occasional pain-killing doses, are unlikely to have a significant effect. They may also increase the risk of side effects on the kidneys. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork. Or you can ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.